Ever had one of those earaches that just drags on? Seems simple, maybe. But, sometimes an ear infection, something so common, can actually have a really complex or even, unusual cause, especially depending on where you happen to be in the world. So today, we're doing a full immersion, a deep dive into exactly that kind of condition, otomycosis. It's a specific type of ear infection. Our mission here is to really unpack it. What is it? What's causing it? What are the sort of unique symptoms you might feel, and the specific treatments? And we're drawing all this directly from the source materials you shared with us.
Right.
Think of it as a fascinating look into the world of fungi, actually, and how they can pop up in unexpected places like the ear canal. It really shows how tiny details can shift the whole picture.
Absolutely.
Okay, so let's start right at the beginning. Otomycosis. We've both been digging into this. What really defines this condition? What are we looking at here, fundamentally?
Well, at its core, otomycosis is simply a fungal infection of the ear canal. What makes it distinct is the cause-specific fungi. Usually it's things like Aspergillus niger or A. fumigatus or sometimes Candida albicans.
Okay, specific fungi. And where does this particular type of, fungal invader tend to set up shop? Is this something you find everywhere, or are there, hot spots?
It's definitely more common in certain places, particularly hot and humid climates. So you see it much more frequently in tropical and subtropical countries.
Ah, right.
And what's really interesting and kind of a key insight from the sources is that this isn't just about geography. It really underlines how environmental factors, like that humidity, can turn a seemingly ordinary ear issue into something quite specific, needing a totally different approach.
That makes sense.
And another crucial point is that it can also show up as a sort of secondary fungal growth. This happens in patients already using topical antibiotics for other ear problems like otitis externa, swimmer's ear.
Oh, right. Okay.
Or even if they have ongoing issues with middle ear discharge separation, the antibiotics might deal with bacteria, but can sometimes create an opportunity for fungi.
So it's not just a straightforward infection then. It's got these geographical links and this potential connection to prior treatments, which naturally leads me to ask, what does it actually feel like for someone? What are the specific clues, the symptoms that might point towards otomycosis instead of just, a regular ear infection?
Well, the primary symptoms people report are pretty intense itching. That's a big one. Also, discomfort or even pain in the ear and a sensation of blockage, like the ear is full.
Okay, intense itching, pain, blockage. But honestly, those could describe a bacterial infection too, couldn't they? Is there anything right at the start in those initial feelings that really shouts fungus, or is it more subtle at first?
That's a fair point. Those initial symptoms can overlap. But one of the more, let's say, telling signs that often comes up with otomycosis is a watery discharge from the ear. And crucially, this discharge often has a distinct kind of musty odor.
Musty, okay, that's specific.
Yeah. And then visually, if you could see inside, the fungal mass itself has a characteristic look. It might be pearly white or brown, sometimes even black. The sources often described it as looking like a wet piece of filter paper lodged in the ear canal.
Wow, a wet piece of filter paper. That's a really vivid image. Almost a bit grim, actually.
It is.
It makes you wonder, though, doesn't it? How many earaches might get brushed off as bacterial when that visual clue or that smell could be pointing to fungus all along? So if it looks so distinct, how do doctors actually see this? What's the process for getting that visual confirmation?
Right. Well, an otoscope examination is absolutely key. That's the standard tool for looking inside the ear. And what's really fascinating, as the sources highlight, is how different the view can be depending on which fungus is causing the trouble.
Ah, okay.
So, for instance, if it's Aspergillus niger, the doctor often sees these black-headed, sort of filamentous, thread-like growths.
Blackheads, right.
If it's Aspergillus fumigatus, it might look pale blue or green instead.
Blue or green, wow.
And then Candida usually presents as more of a white or creamy deposit, like cheesy patches sometimes.
Okay.
But regardless of the specific fungus, the skin lining the ear canal, the medial skin nearly always looks, unhealthy. It appears sodden, red, and edematous, which just means swollen.
So the otoscope isn't just saying infection, it's almost like it's identifying the specific fungal culprit right there on the spot based on how it looks. That's a level of detail that really stood out in the sources for an ear condition, didn't it?
It really did. Those visual characteristics are quite unique.
Which brings us then to the really important part for anyone dealing with this treatment. Once it's identified, how do doctors actually go about getting rid of otomycosis? What's the approach?
Okay, so the absolute first step, the foundation of treatment, is what's called a thorough ear toilet.
Ear toilet.
Yeah, it sounds a bit clinical, but think of it like prepping a surface.
Yeah.
You need to meticulously clean the ear canal, remove all that discharge and any dead skin or epithelial debris, because all that stuff, it's basically food for the fungus. It helps it grow.
Right, creates the right environment for it.
Exactly. So this cleaning can be done in a few ways, maybe gentle syringing with water or using suction or carefully mopping it out with tiny swabs. The goal is just to get the canal as clean as possible.
Makes sense. Clean the slate. And after that cleaning, what happens next? What are the specific medications used to actually kill off the fungus?
Once it's clean, that's when the antifungal agents come in. There are specific ones that work well. For example, nystatin, often prepared in special ear drops, maybe with propylene glycol, is known to be particularly good against candida.
Okay, nystatin for candida.
Yep. Then there are broader spectrum antifungals like clotrimazole, that's quite common. Povidone iodine solutions can also be used.
Right.
And another interesting one mentioned is 2% salicylic acid in alcohol. This one's kind of clever because it has a dual action.
Oh, how so?
Well, salicylic acid is what's called a keratolytic agent. It helps gently remove the very top layers of the skin epidermis. And since the fungal threads, the mycelia, tend to grow into those superficial layers, removing them physically helps get rid of the fungus. It allows the other antifungals to penetrate better too.
Ah, I see. So it helps clear the way.
Exactly. But here's a really critical point that the sources stressed. Antifungal treatment must be continued for a full week, even after it looks like it's completely cured.
A whole week after it seems better. Why is that so important?
Because fungi, especially these types, are notoriously persistent. You might clear the visible signs, the main bulk of the infection, but microscopic fungal elements can easily remain. If you stop treatment too soon, those remnants can just regrow, and boom, the infection comes right back. Recurrence is a real issue.
Got it. So persistence is key on the treatment side too.
Absolutely. It's a vital lesson in not just suppressing symptoms, but truly eradicating the infection. And, connecting this to the bigger picture, the overall care strategy, it's important to remember that bacterial infections often coexist with otomycosis. It's not always just one or the other.
Right. It can be a mixed infection.
Precisely. So in those cases, doctors often use a combination preparation, something with both an antibiotic and a steroid, alongside the antifungal. The antibiotic tackles the bacteria, obviously, and the steroid helps reduce that inflammation and swelling, the edema we talked about.
And that helps the antifungal work better.
Exactly. Less swelling, less inflammation means the antifungal drops or creams can penetrate more effectively down into the ear canal and reach the fungus. It's about creating the optimal conditions for the treatment to succeed. A comprehensive approach.
Okay. So wrapping this up, we've really journeyed through otomycosis. We've learned it's this fungal infection often linked to climate with some pretty distinct symptoms like that intense itch and the musty discharge. We saw how diagnosis hinges on that otoscope view, revealing those unique visual clues for different fungi. And the treatment, it starts with that crucial cleaning, the ear toilet, followed by specific antifungals like nystatin or clotrimazole,
Right.
and maybe salicylic acid, or even adding antibiotics and steroids if needed. But the absolute key takeaway, it seems, from the sources was that need to continue treatment after symptoms disappear to really beat it and prevent recurrence. That fungal persistence is no joke.
Exactly.
You've definitely gained a deep, quite nuanced understanding of this very specific and I think quite fascinating medical condition from our dive into the materials.
And reflecting on all this, it really raises a broader, maybe more thought-provoking question for you to consider, doesn't it?
Okay.
How does our environment, the climate we live in, our previous medical treatments, even the specific visual look of an infection inside the ear, how do all these factors actually combine to shape a precise diagnosis and lead to an effective treatment plan? Not just for otomycosis, really, but perhaps for many health challenges we face more broadly.
That's a great point to ponder. Thank you for joining us on this deep dive into the source material today. We hope you're leaving with a much clearer, more detailed picture of otomycosis.